Hi, my name's Caleb LaSalle. I'm doing a project for my class Leadership 620 with Professor Diaz. We're talking about implementing strategic change within the facility that we work. For me, I'm through Banner Health, so I chose a change that I could see happen within our facility that would both increase patient safety, care, and reach our goals. And let's just jump right into it. So the mission, let's just start with what Banner Health's all about making healthcare easier so life can be better. Right off the top, that's our goal. We want patients to come in here. We want them to feel safe. We want them to feel secure. Want them to trust that we are looking out for their best interests, that we are making actions, making plans in order to see that through. So really, we need to make sure that whatever change we make, whatever goal we're trying to find, whatever mission we're personally trying to achieve aligns with this. What does this mean for the care that we try to give in this facility? Is just that whatever we're doing, we're trying to promote those patients. Make their lives better, long term, both short term, meet their needs in this time, and then work with them to see everything through. Banner's already fantastic at having just extended resources to reach all the needs of patients, really in any situation. So we already have a great platform, and I just want to see about making a different change that could see this through even better, to reach this goal and reach our mission at even greater heights than we already have right now. So why change? Personal experience. I am a floor nurse working in the hospital. I have seen unsafe conditions for both the nurse and the patient. Right now, we have at times limited staff with limited resources in order to meet the needs that we have and see our patients through. This causes so many safety concerns on both sides of the pallet. We have nurses that are being overworked, that they can't reach their patients. We're seeing an increase in falls. Different safety concerns are arising, not to mention the strain that it puts on the nurse both physically and emotionally. It's also causing high turnover rates right now because of the stressful situations that we've been having. You have these people that come in, the travel nurses that come in on contract, which are great, and they fill a void for just a temporary amount of time. But we're still seeing that even then, in my own experience, they can't wait to get out because of how the situation is run right now. Really, they're getting their 8 to 12 weeks, and they're getting out of town. Even a lot of nurses that are on the floors are trying to figure out anything to get out of it. So we need to try to make a change that both makes the patients safer and the nurses safer, but also decreases that turnover rate, and all around it's just stressful. When you come into a day and you may not even get a lunch, you go 12 and a half hours straight, it feels like, without sitting down. It really makes it hard to come back in that next day. So again, why do we need to change? This is a big reason why. The change. So what I'm proposing is to change the idea of how we set up ratios. A lot of times we come in and we have 5 to 6 patients per nurse. 6 is kind of pushing it for almost anything. It really makes it difficult in order to get to the patient care. California has actually already enacted state legislation that limits 5 nurses or 5 patients to 1 nurse at any single time. It's already a great start, and it's already shown improvement. Worker compensation claims against facilities by nurses has already dropped 30% since 2004 when this was implemented. They did have to hire more staff, which is always the biggest concern, is the numbers. How much does it cost? How much does it cost? How much does it cost? And of course, that's a big deal. But when you have less claims being brought against you, you're already looking better in terms of worker compensation, payouts, different things like that being sued. Not to mention, if you can actually care for your patients, catch things sooner, detect a patient declining faster, you're going to have less lawsuits against patients suing the facility, which we know that's something that happens fairly consistently with almost any healthcare facility. So working on ways to decrease both of those angles, protecting our patients and our staff, is a great way to do that. And I think Banner would be a great front runner on leading that change beyond just California, really showing that they're dedicated to making a difference beyond just where they're at. So, what will this do? This allows nurses to have time to care for the patients. If I come in as a nurse and I have 6 patients and no aide, nobody to help me, no huck taking phone calls, which I have on many a times, how am I supposed to care for an 85-year-old who needs 25, 30 minutes to get up, go to the restroom, and get back, get them cleaned up, get them comfortable back where they need to be, where they're safe? How am I supposed to do that? My only other option is to let them lay there in their own feces or excrement, which is just unacceptable in my standards whatsoever. I don't care what the situation is. That's just completely unacceptable. And as with almost every nurse I know, that's not a situation that they're looking forward to. So what this will do is allow a little more time. When you have less patients to jumble and try to prioritize or work around, you have more time to just go in and check on them, see how they're doing, what can we do to help you, what can we do to make your day better, how can we make this day more satisfactory to you. It opens up time for nurses to expedite care. When you have a patient that nothing's been done in 6, 8, 12 hours, and it's really because they actually just need to have a couple phone calls made. I could tell you from experience, again, sometimes it takes you 20 minutes to sit down and make those consecutive phone calls in order to get what you need. But sometimes you don't have that 20 minutes when you have, 3 or 4 patients that need pain medication, 3 or 4 patients that are diabetics, need their insulins checked, and then insulin dose correctional given to them. It's really, really, really tough to sit down and make phone calls when you have a patient saying that they need to go to the bathroom and they've been in there for 30 or 40 minutes. What's more important? This care necessarily happening now, or making sure that the patient needs in that moment are met when there's no one else to really have, when you just have too many patients. So really, it just can help expedite care. It's going to decrease the number of hours that the patient stay is, which we've been seeing an issue with. And not only it increases patient safety and nurse safety, as we talked about. That 30% decrease in worker compensation claims just is a huge number and really shows how big of an issue this whole thing is. I'm a big boy. I can pick people up and move them, but I can't be doing that forever. It can't be taking somebody that needs 2 people and just doing it myself for too long. And especially some of these women that work here, we're talking 5'2", $110. We just can't do it. We need to make sure that our nurses are safe and our patients are safe at all times. And having the necessary number of staff, making it toward nurses and our aides and everybody involved, has a few extra moments of almost free time in order to work on all these issues that need to be addressed. There's our references, and I'll take any questions on the entire topic. Really just look into details. And at the end of this is just about patient safety, nurse safety, in order to making the entire job experience for both the staff better, but also for the patient. Those satisfaction scores go up. Our goal really, in order to evaluate this, would be looking at the number of patients that declined before the change and after the change, catching those situations before they happen. And really, if their overall satisfaction scores goes up and safety is increased, I'm talking less falls, less medication errors, then we're on the right track. Thank you for hearing me out, and I'll take any questions.